So if you're anything like me, you like to roughhouse and wrestle with your kids. Oh my goodness, my crown just fell out. What do I do? Hi, I'm Dr. Brett Langston. I'm a prosthodontist. I'm the owner at Dental Implant and Aesthetic Specialists of Atlanta, and I'm here to help you watch your mouth.
Down in Brookhaven with a smile shining bright, Dr. Brett Langston's working late into the night. With hands steady and a gaze so keen, he's the best on prosthodontist you've ever seen.
One of the things we do a lot, we see it at least once or twice a week, is a patient calls in a panic because their tooth has fallen out. Now, the majority of the time, that just means the crown has fallen out. But when you're panicked and scared, all of a sudden your mouth doesn't look the same. You might be in pain, you might be embarrassed, your crown's in your hand, and you don't know what to do. Give us a call. We always get those patients in right away, and we sit down and we take a look and figure out the best plan of action. So typically what happens is when a crown comes out, there's one of two reasons. Either the cement layer that has bonded that crown in has just failed over time. We have a lot of patients that got crowns 40, 50 years ago that are still doing great, but all of a sudden the crown's out. They're typically not in pain, the tooth underneath is healthy, but the crown's in their hand. If that's a situation where that cement layer has kind of worn away, we clean everything up. If there's no decay and the crown fits, we just put a new layer of cement, put it back in there, and hope for another 30, 40, 50 years. Very straightforward, very non-involved. Occasionally, when the crown comes out, what happens is the tooth is actually broken. And so if the tooth is broken, or if the tooth has decay where the crown no longer fits, that's going to be, unfortunately, a lot more involved process to restore that. A lot of times we can't just put the crown right back on because the underlying tooth is not healthy enough to support that. At that point, it becomes either we can modify the tooth, take out the unhealthy tooth structure, and make you a new crown. A lot of times, same day crown. Appointment takes about an hour and a half. You can leave that day with a new crown that protects the tooth and blends in with the rest of your teeth. Or if it's more involved and the tooth has to be extracted or needs a root canal, sometimes there are more involved options that we have to do. One of the nice things about our office is that we're able to do all those services here. If the tooth needs a root canal, if it needs to be extracted, if we need to place an implant, these are all options that we can take up in-house with our talented team of doctors. So if you're wrestling with your dogs and they bonk you in the chin and all of a sudden you've got a tooth in your hand, give us a call, don't panic, we'll get you right in and we'll find a solution. No matter where you are, if that happens, give us a call. We'll get you in. We'll take care of you, whether you're in New York, whether you're in LA, whether you're in Macon, whether you're in Brookhaven, wherever you are across the country, give us a call. We'll get you in. We can walk you through your options to get you taken care of. I'm Dr. Brett Langston. I'm a prosthodontist. I'm the owner of Dental Implant and Aesthetic Specialists located in Brookhaven, Georgia, and we're here to help you watch your mouth.